Hi everyone, myself Mrs. M.Roslin Mangaiyarkarasi, Department of Community Health Nursing, E.S College of Nursing. So, my presentation topic is minor elements. Definitions of minor elements. So, minor elements indicate slight illnesses. It also includes the emergencies of smaller nature. And also it defined as the health complaint which by simple action patients could handle themselves. So it is nothing but medical condition that will resolve on their own and can be reasonably self-diagnosed and self-managed with over-the-counter medications. This is called as minor elements. Next, principles of managing the minor elements. So the first principle is ensure the safe and healthful environment to the patient. The environment should be kept in silent and very peacefully and also ventilated. So this is the safe thing to the patient. And then second thing, treat the risk injured person promptly. It will prevent any complication. And third thing is, in case of infectious diseases, take appropriate precautions to prevent the spread of infection. And fourth principle, keep the continuous watch over the patients and vital signs during the period of care. In that minor elements, vital signs is very important because this is the, if the patient go for a shock or any other serious conditions, the vital signs is very useful for that further management. The next principles use the opportunities of health education during the care. The health education is important to prevent and for the future for all the things. So health education during the care is very important for the minor elements. And then follow the physician instructions during the treatment. Then family members to cope up with the situation and for taking care of the patient and home also. Then reassure the family members. If in case the first aid will not work properly or the patient go for serious condition, immediately refer the patient to near the hospital. Next, general steps in management of minor elements. So the first step is the clear history taking is very important for the management. So taking history from the patient, family very carefully. Then perform physical examination and necessary investigation. It will helpful to detect the causes of the problem for the further management. Then making the diagnosis and planning for care and implementing the nursing care and following the standard instructions. So finally it will evaluate the progress of the patient. If the outcome is successful, then plan for the follow-up. If the outcome has failed, if the condition of the patient does not improve or show the serious signs, immediately refer the patient to the primary health center or nearby the hospital. Standing orders. Standing orders is nothing but the specific instructions regarding the treatment for conditions that nurses and other healthcare workers. It will meet the homes, schools, industries, where a doctor is not readily available. It's nothing but all the nurses and the other workers following the same instructions and the same order. For best example, ORS in cases of the rehydration. The first minor elements is fever. So if the fever has continuously occurred means check the vital signs, observe the signs and symptoms of the child or patient such as headache, nausea, vomiting, diarrhea, running nose, cold and cough. So advise the patient to take the complete bed rest and take a light diet. So if the patient fever is not reduced within the 3 days, take blood smear for malaria. And also the patient having the fever only the evening time means, and also take the blood smear. So next, advise the plenty of oral fluid. Plenty of oral fluid will reduce the dehydration. It will prevent the dehydration. For example, fruit juice, rice water, etc. If the patient having hyperthermia, give the cold sponge. If any rashes occurs in the body, immediately note the type and distributions of the rash, and also the isolate the patient. Inform to the medical officer of the primary health center. So next one is cough. So find out the cough duration and color and amount of sputum, where there is the fever, sore throat, pain, chest, dyspnea and vomiting and loss of weight. So if the continuous cough is occurred means, give aspirin tablets and the fluids and balanced diet. So give steam inhalation if there is the cough and cold. If the patient feel comfortable, and advice for rest. If tuberculosis is suspected, refer to the hospital. The next thing is sore throat. If the patient is having the pain in the throat, immediately you have to watch the throat physical examination. You have to be done in the throat very carefully. So record the vital signs if the patient is having the fever or not. So inspect the sore throat for evidence of redness and white patches. If the white patches and other signs of the diphtheria is seen, to refer the hospital immediately. Then send the throat swab to laboratory. If pharyngitis is present, give the saline gargle. That pharyngitis is nothing but inflammation or infections occurs in the pharynx. Next, give aspirin. If there is history of recurrent tonsillitis, refer to the hospital for treatment. Tonsillitis is nothing but infection or inflammation of the tonsils. So advise the patient to take the syrup of honey with hot water. It will relieve the pain. So the next thing, inflamed eyes or eyes with the discharges. So if the patient having the eyes discharges or infected eyes, so wash the eyes with water and clean with the cotton swab. So cover with the sterile eye pad and bandages. So the patient feels comfortable. Next, refer the patient to the hospital when any wound that cuts or ruptures the eyeball. The next thing is ear ache. Ache means nothing but pain. If the children is having or any other patient or person is having the ear ache, so look at the ear very carefully. If the any discharges or wounds present in the ear, so clean the ears first and apply the ear drops prescribed by the doctor and give paracetamol tablet for 3 days. If it's not reduced the pain within the 3 days, refer the hospital nearby the area. Next, ear discharges. So ear discharges with external ear soreness, clean with the boric acid lotion and apply the ear drops. If isolated with other problems like nose and throat, infections or impaired hearing, after to the primary center. The next elements is convulsion and fits. So if the patient getting the convulsion of the person getting the fits, make the patient lie down with head turned to one side. So place a small and clean cloth between his teeth. It will prevent from the biting the tongue. So do not restrain him her during a fit. So well ventilated rooms provided and her clothes should be loosened. So after he recovers from the fit, given a hot tea with plenty of sugar. The patient is dehydrated and also too tired. So after the recovers from the fit, you have to given hot tea with plenty of sugar. Next, protect him from any danger like fire or sharp stones. So obtain the history and also refer the patient to the hospital. The next thing is diarrhea. It is the most common minor elements in our country. So if the patient is getting the diarrhea, the first observe the signs of dehydration. That is dry mouth, sunken eyes, loss of elasticity of the skin. So if available, give half cup of orange juice or little almond juice. The children needed at least 1 liter of a day and the adult 3.5 liters. The plenty of oral fluids, it will prevent the dehydration. So severe dehydration refers to the health center or the hospital and teach the patient and patient mother. So disinfection and proper disposal of the stools. Advise a diet of rice water and coconut water, mashed banana and grated apple. So it will treat with diarrhea. So teach the mothers to use the disappears for the children. It will prevent for the further spread of the disease. To protect the food from fly contamination. So food also always covered with the lid or any cover. So it will protect the food. Advise the importance of drinking chlorinated water or drinking boiled and cooled water. So use the fly control measures and inform the PHC, that is the primary health center, regarding the diarrhea situations. So ORS is very important thing for the using the dehydration, that is the diarrhea. Next, constipation. The patient does not pass the stool freely at least within the 3 days. You have to advise the patient to take the plenty of fluids and fruits and green leafy vegetables and foods with the natural fibers. In order to have the regular bowel movements, so order the people to need to walk and exercise regularly. And advise the mild laxatives to the patient suffering from constipations. It will relieve the constipation. Next, skin rashes. Under that skin rashes, if the child or any other person affected with the skin rashes, immediately check the vital signs. So examine the type of the skin rashes and distribution and find out the duration of the rashes. Ascertain the possible contact with the communicable disease, example the measles. So and then immediately isolate the client or patient. And then refer to the primary health center or nearby the hospital. If the patient having the fever, give the tablet aspirin 10 gram for adults and 5 gram for children. Next, wounds. So if the person get the wound, immediately wash the wound with the soap of water and apply ointment which prescribed by the doctor. Avoid contact with dirt and refer to the primary health center and give the TT injection. It will prevent the septic. Then if external bleeding there, apply the sterile dressing and elevate the part and apply pressure. So why elevate the part? Means the bleeding will controlled. Next, animal bite. If the person having animal bite, get animal bite or any other like the dog bite or rat bite. So immediately wash the wound with soap and water for animal bites. So observe signs and symptoms of rabies. If the animal is without the symptoms, watch the animal for 10 days. If he shows the symptoms of rabies, ship to the hospital for the treatment of the anti-rabies. Then flush the wound with saline or water. Then apply the ice to the wound to delay the absorption of the venom. So shift the patient to hospital immediately. If non-poisonous, clean the wound with saline and water, apply the tincture. If the wound is too deep means refer to the hospital. Next, snake bite. So it is the very dangerous minor elements and also a emergency. If poisonous means apply the tourniquet or cloth to impede the venous blood flow from the site of bite toward the heart. So small cut into each fang mark with a clean knife about 1 centimeter long and half centimeter deep. Suck the poisonous through the suction machine and breast pump. So wash the wound with saline or water and applies the ice to the wound to delay the absorption. So the person lie quietly, do not move the part that has been bitten. So shift the patient to the hospital. So in between the patient shifting, check the vital signs hourly. Next, burns. So remove the non-adherent clothing and clothing away from the wound is the first thing. And then remove the rings, bangles and shoes, belt before the part being to the fill. That is the remove all the ornaments with the body. Then assess the burns area. Then reassure the patient. Check the patient if the patient is having dehydration. If medical aid is delayed, start to the oral rehydration fluid. It will prevent the dehydration. So treat for shock. Then transfer the patient to the hospital. Next, fracture. In that fracture, first immobilize the part with footboards. Then give support the injured part by bandages and slings. Then shift the patient to the hospital. In that fractured area, do not rub or any other mobilized thing. Do not follow that area, fractured area. So that's why we first immobilize the part with footboards. So if any major fracture suspected, immediately shifted to the hospital. So next, anemia. This is the most common minor elements in our adult things. Adult age peoples to get mainly focused on the female adult people. So advise the person to eat green leafy vegetables like the spinaches, amaranth and beans, peas, jaggery, egg and liver. So advise the oral iron and vitamins. So advise dried fruits and dates. So it will get more irons. Stool examined for hookworks. Then hemoglobin test, monthly hemoglobin test should be taken. So the bedding piles, the menstrual disorders with excessive bleeding and other bleeding condition have to be referred to the primary health center and hospital immediately for the follow-up. And the next thing is shock. The patient getting shock immediately in case of the foot of the bed raised about the 22 centimeter. Give first aid for bleeding fractures, bites. Keep him warm and reassure the patient. If patient is conscious, give strong hot tea with plenty of sugar provided he is not expected to undergo an anesthesia. The next thing is edema. So if the edema is nothing but suddenly the fluid accumulation in the part, so advise the low salt diet and daily records, and mainly focused on the follow the intake and output maintained. Then find out the causes and refers to the primary health center and examine the urine for albumin. And then bleeding nose. So immediately the person having nose from the bleeding, so make a patient set up with head erect and bent forward. So loosen all the cloths at neck. So tell the patient to pinch nose at the junction of the hard and soft part. So apply a cold compress. Do not let him blow the nose. If the blood does not arrested, so transfer the patient to the hospital. So this is the minor management of the bleeding nose. Thank you.